Within 10 years, it is estimated that there will be 5 million people with diabetes in the UK. Patients with type 1 diabetes will be able to replace insulin injections with pump therapy. There have been terrific advances in this technology, yet still, the UK's usage of insulin pumps is lower than its EU counterparts. Cellnovo's new technology may change all that and allow patients to take better control of their diabetes. Sharon Thomas reports.
Sam Irvine lives with his family in South Wales. He's 18 and studying to go to university. 6 years ago, Sam was diagnosed with type 1 diabetes. He'd always used an insulin pen for his multiple daily injections. He closely monitored his blood glucose levels and kept a food diary. But for the last 18 months, he's been using a new innovative insulin pump, and it's enhanced his life.
The issue with the old technology is that you can only deliver a flat rate for 24 hours. It can't adjust to individual actions at whatever you're doing at a certain time. With the new technology, in this case this pump, you're allowed to adjust it on an individual hourly basis. So if you're sleeping, you lower the rate delivered. If you're walking, you lower the rate delivered. So basically you maintain your blood sugar levels at a certain amount and a far greater ability. On a practical level, it's discreet. The tubing itself is very small as well, so it can't get tangled. It's just it's simply far easier to use.
It's giving him the confidence because it's like a little pump now instead of injecting.
That's right. He's able to have the flexibility that he didn't have previously when he was injecting, and it's given him a far better control of his life, and not only that, his diabetes as well.
Its creators say this mobile diabetes management system is the way forward in helping people take control of their condition. It's wearable. The patient has this attached to their skin under the clothing. It operates wirelessly and delivers insulin on demand. The data generated can then be viewed in real time. Here at Cellnovo in Swansea, they're committed to empowering patients with diabetes, giving them more control over their condition and therefore improving their quality of life. The company has created, developed and now manufactures advanced technologies that it hopes will help many of the 400,000 people in the UK who are living with type 1 diabetes.
We looked out at the state-of-the-art technologies to see what was available, and we saw pumps that were both bulky and inconvenient. So we tried to create something that was small, discreet and wearable under the clothes. But also we wanted to use the modern technologies of telemedicine and e-health to ensure that the patient could become a partner at the centre of their treatment.
The use of new technology is essential for the NHS to meet the burden of an escalating number of people with diabetes. The mobile technology integrated into the Cellnovo system enables patients to view and manage their insulin pump data in real time. Data is transferred from the patient's pump to a secure website in real time, which also helps to support remote consultations with healthcare professionals. Without closely monitoring their condition, patients are at greater risk of developing long-term complications.
I think it's crucial that we embrace new technologies which ultimately I think are going to be beneficial for patients and cost saving. If we can take on technologies that allow people to get better real-time data about their condition, then it allows them to engage and to manage their condition better. Ultimately, that's not only good for the patient's everyday life, but it also means that in the long term, the complications of diabetes can be reduced.
The main thing about this system is that I can see the patient's data in real time.
Dr. Pete Jennings has been a diabetes specialist nurse for 12 years. He has had the condition himself for twice that long. This new technology allows him to monitor his patients remotely.
One of the benefits for patients is that it's a pump, patch pump, so it connects to them. They don't have to worry about tubing, and it's very unobtrusive to wear. For me as a healthcare provider, the pump automatically records all of the information that the patient is doing while they're wearing the pump, and it's very easy for me to access that information by logging into a computer, and I can use that then when I'm discussing the patient's results with them over the phone.
Cellnovo, giving people with diabetes the support they need to take control of their own condition and help them live their lives to the full.